Medigroup Physician Services presents Medigroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Christie Devine, Product Manager for Women's Health with Siemens Healthineers. Now here's your host, Medigroup's Frank Gillespie.
Well, hello, and nice to be with you again. Welcome to another edition of Medigroup's Frank's Fast Five. Today, ladies and gentlemen, I have the privilege of sharing some conversation with Christie Devine, Product Manager, Women's Health for Siemens Healthineers. Christie will be sharing some information for us related to breast cancer screening. Christie, it's an honor, and it's glad to have you here, and welcome. How are you?
I'm well. Thank you, Frank. I really appreciate you having me on today. This is a great opportunity to talk with you and your listeners.
I am honored that you're here. Thank you very, very much. Good to see you. I appreciate it. Well, Christie, I promised you I wouldn't waste your time. I'd dive right into these questions, so we're going to make it happen right now. So thank you very much. First question, Christie, can you share what Siemens Healthineers sees as the top trends shaping the future of breast cancer screening today?
Yeah, there's quite a few trends affecting the future of breast cancer detection, but the top three to point out, I think, are a move towards individualized screening recommendations that are emphasizing a tailored approach to match each patient's specific risk factors. And those tailored approach may go beyond mammography. Another trend we see is a focus to improve patient access to those breast cancer screening tools. And then finally, a growing patient population who are informed and aware of advances in their care options.
The tailored approach has a lot of meaning, I think, today in today's world for everybody, men, women, but especially in this arena, particularly, I would think. So very interesting.
Absolutely.
So, Christie, how do these trends impact the delivery of care?
That movement towards individualized screening, it means that we have a demand for these services as well, which place greater pressures on healthcare systems. That increased demand can lead to longer wait times, and we always want to make sure we ensure equitable access. That's always our persistent challenge. And then as public awareness increases, patients expect state-of-the-art care. Absolutely. This shift empowers patients, but also requires healthcare providers to stay at the forefront of technological advancements. And it can be a challenge to keep up with technology, particularly when we talk about the cost associated with it. In some cases, there's an added cost of needing to beef up infrastructure to implement that technology.
It's interesting because we think of it a lot of times from the cost to the patient, but there's also the cost to the provider as well in terms of staying up with the technology, to your point. So very interesting. It's a fine balance, certainly, in terms of what we're trying to do, but we certainly want it to lean towards the benefit of the patient, I'm sure.
Yes, absolutely.
Christie, how does outpatient delivery of care help address these challenges?
Outpatient facilities bring those services closer to patients. They can be located near their homes or other essential amenities, making it easier for women to access the care they need. So that's really cool. And then by decentralizing services from like those larger hospitals to outpatient settings, we can also alleviate the burden on overtaxed systems, thereby reducing wait times for patients. And outpatient care is often more affordable for patients. And this cost effectiveness is highly appreciated by patients, making it a preferred option for many. And we can also see a benefit of maybe a less intimidating care delivery and improved care coordination. Those outpatient settings might be less formal and more welcoming, which can reduce patient anxiety and improve the overall experience. And these settings allow for seamless coordination with other healthcare providers, such as a patient's PCP or OB-GYN, really ensuring a holistic approach to their care.
The holistic approach, that makes a lot of sense for sure. Kind of a one-stop shop, and it also allows the outpatient setting allows that to become part of the patient's schedule for their day. It's one more stop they have to make. May not be the stop they want to make, but it's part of the day, and they can continue on with their life and at the same time get their treatment and do what they need to do to carry forth. Oh, all very interesting.
Absolutely.
Question number 4, Christie, is outpatient care is uniquely positioned then to help with these trends, as we've talked about. It seems with the growing demand for outpatient facilities, they may face their own set of challenges. What are those, or some of those?
Yeah, ensuring outpatient centers are adequately staffed with skilled professionals is critical. The frontline staff taking care of patients, they're imperative to obtaining quality imaging and correct diagnosis.
Sure.
And we continue to see a demand rise, but not necessarily the folks trained up to fill those vacancies.
Mhm.
Also providing a high quality patient experience from the moment a patient walks through the door, it remains a top priority as well. And then finally, they need a way to stay current with technology and keeping up with that latest advancements in screening without incurring prohibitive costs is
Sure.
significant concern because the well-informed and knowledgeable patients, they expect state-of-the-art care.
Absolutely. And they're more informed today because of the internet and WebMD and all these other things.
Absolutely.
So they're actually armed and ready to go when they come in. They may not have all of the facts because they're not the doctor, but they know some questions to ask, which is I
Yes.
find fascinating. I'm actually having some tests of my own, but I've already done the research on the back end and have a lot of questions going in. So yeah, absolutely. Same sort of thing, I think. Um,
Yeah.
Last question, and I told you this would go quick. You've done great. I really appreciate it. How can Siemens Healthineers support providers as they navigate these challenges in outpatient care? And I know that's a loaded question, but a few examples.
Yeah, I appreciate you asking this question. First off, to address the workforce,
Yeah.
we Siemens Education and Workforce Solutions, they can help support those outpatient clinics through staffing their own mammography practices. Additionally, Siemens provides resources for ongoing professional development and certification, helping clinics maintain that high quality or high qualified workforce,
Yes.
so they can meet the increasing demand for breast imaging. And then regarding the patient experience, ensuring patient comfort encourages patients to willingly participate in regular screenings, which is proven to reduce breast cancer mortality because we can find cancers earlier when they're more treatable. And then providing an exceptional patient experience ensures women who, by the way, make 80% of healthcare decisions for their family. I like to call them the chief health officer of the family.
Absolutely.
You want them to think about their experience in a way that they'll come back to you and also bring their family too.
Absolutely.
So some things that we've done with that is we rounded the edges of our paddles to alleviate pressure points. We have an optimized face shield that allows patients to lean into the exam, which helps get more posterior tissue. And then studies show the ambiance of the care setting directly affects the perception of pain and can reduce anxiety. So we include mood lighting that brings a smile to the patient's face and free wall decor. And I think the cherry on top of this is our unique intelligent compression system. This system delivers the right amount of compression consistently and comfortably. We call it OpComp, which means we can help organizations get the optimal compression for the optimal image, and we can do it consistently.
Gotcha.
And then last but not least, I know this is a long answer to your question,
I
Frank, but
love it. No, please. It's
we
great.
want we want every patient to have access to the most advanced technology available, right? So Siemens has always set itself apart through innovation.
Yep.
In breast cancer detection, we are the only vendor to provide 3D mammography, using 50-degree wide angle technology. A challenge inherent to mammography is the overlapping breast tissue, which can
Sure.
obscure abnormalities or create false positives, particularly for patients with dense breasts. So breast tomosynthesis, or also known as 3D, addresses those challenges by separating the tissue.
Okay.
It takes the series of detailed images of the breast from different angles, and a wider angle means improved tissue separation.
Makes sense. Yes.
Yeah, other vendors use more of a narrow angle, just 15 and 25, which is maybe not separate those tissues as well as a 50-degree angle.
Makes a lot
On
of
top
sense.
of that, we continue to expand our fleet of mammography units. So we just welcomed MammoMap Be Brilliant, with our 50-degree wide angle technology, but we made her faster. We optimized the technologist workflow, and we maintain those patient comfort features, which means that Be Brilliant will never be the bottleneck to taking care of more
Sure.
patients. So you can expand access to more people.
Absolutely. Absolutely. You have the gamut of everything at Siemens, and I love that. I love doing these webinars with your team because I always learn more as well because you're always on the forefront of doing new things. So this is educational, not just for me, but for the entire audience. I love it.
May
Um,
May I add one more
Oh, I'm
thing?
sorry, Christie. I didn't mean to cut you off.
No,
Please
no,
do.
you didn't cut me off.
Okay.
I just want to tell you what I think the best part is.
Oh, please.
I
Yes,
think the
please.
best part, I think the best part is we provide this exceptional technology at a very reasonable cost. So we talked about, maybe new technology can be cost prohibitive, but
Right.
we like to make sure that the total cost of ownership is really attractive. And we specifically build those units so that they can grow with the needs of our customers. So, if I'm just starting out, maybe I'm just doing screening, but then I determine I need to add on services as time goes by, I can take that same mammo unit that I purchased and just add right onto it with no problem.
Bolt new things onto it. That's awesome. That
Yes,
is
yeah.
really cool. I like that. That is really great. So friendly, welcoming, and full of technology. Why would you do anything else other than Siemens? I love it. So
Thank you.
yeah, absolutely. Christie, you've been a delight to talk with. Lots of information. Thank you so much. Thanks for the time. I really appreciate it.
Thank you, Frank. I appreciate it.
You're quite welcome. Take care and have a great rest of the week.
You too.
Thank you.
This has been MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Christie Devine, Product Manager, Women's Health with Siemens Healthineers. This has been a presentation of MediGroup Physician Services.